Have you ever had a UTI? You probably took antibiotics and they worked. Listen in to see if alternatives to antibiotics work just as well. Hello, pharmacists and friends. Today is Friday, June 14th, 2024. Welcome to the Regimen, where public health pharmacists, pharmacy students, and our guests discuss the latest public health issues and solutions. Listen in to find out how we all can improve population health, health equity, and patient care through advocacy and education. My name's Liz Arnold. I'm a 6th and final year Doctor of Pharmacy student at the University of Rhode Island, working alongside Dr. Bratberg in the Rhode Island Department of Health.
And I'm Jeff Bratberg. I'm a clinical professor of pharmacy practice and clinical research at the URI College of Pharmacy and the academic collaborations officer at the Rhode Island Department of Health. As a reminder to our listeners, the opinions expressed in this podcast do not represent the opinions of the United States government, the Rhode Island Department of Health, nor the University of Rhode Island. So Liz, what inspired you to do this podcast topic?
So a couple of years ago, it was actually, I think, my first month working in pharmacy, a woman came up to me and asked, she was holding 2 different boxes of azo products, and she asked which one she should get. And when I asked her what was going on, she said she thought she had a UTI but wasn't sure, and I ended up advising her to go to the doctor to get tested.
Very interesting. Good use of counseling technique by pharmacists there. So you mentioned azo. What is it, and why shouldn't people treat their UTI symptoms?
So azo or phenazopyridine is a urinary pain reliever. While it does relieve symptoms, it does not get rid of the infection. Urinary tract infections, or UTIs, are one of the most common bacterial infections. Although they can occur in both men and women, they are much more common in women. It's been found that over half of all women will experience a UTI at some point in their life. Out of these women, about half will experience a recurrent infection, meaning another UTI within 6 months or 2 more within 12 months. At least 1 out of 3 women can experience a recurrent infection within 4 months. Yeah,
I never knew, I teach this all the time, and I never knew how prevalent those recurrent infections are, and it's incredibly disruptive to quality of life for these women. When we talk about UTI symptoms in this story about the person asking for azo as a pain reliever, we know that pain is one of those symptoms, but there's many other, again, that sort of ruin people's quality of life when you have it. It's having to urinate more frequently, including during the night. Urgency, again, pain or what's a feeling of burning with urination, and possibly pain in the lower abdomen above the pubic area, or pain in the side, which is often called flank pain. And then if we do testing, you can find blood in the urine or systemic symptoms like fever, nausea, and vomiting. So you really need urine testing to confirm infection, especially with recurrent infections, which often involves a visit to the doctor. There's actually over 10 million visits annually for UTI symptoms. Some of these UTIs can be serious too. They can lead to hospitalization, over 100,000 hospitalizations every year, and all of these healthcare encounters in total cost over $3 billion annually. So there's a lot of interest in preventing and treating UTIs.
Yeah, identifying and treating these infections quickly and efficiently is crucial for preventing complications like kidney infection or even sepsis.
Yeah, so it's important also that because a large proportion of the people experiencing UTIs are actually younger women or premenopausal women, so it's important that we make sure that these symptoms are not sexually transmitted infections or what are called STIs or formerly called STDs. The antibiotics that we use to treat UTIs do not treat STIs. So it's important that we identify whether it's a UTI or an STI because more people than ever are being diagnosed with STIs, even though most are curable. So for people who are at risk for both types of infections, this is why proper testing is so important so that the right antibiotics can be used for the right infection and prevent transmission, especially for STIs. So let's go back to UTIs. What kinds of bacteria typically cause UTIs?
Some of the most common bacteria responsible for UTIs are E. coli, Enterococcus, and Klebsiella. Typical antibiotics used in UTIs are trimethoprim, sulfamethoxazole or Bactrim, nitrofurantoin or macrobid, and ciprofloxacin. Antibiotic selection, strength, and treatment duration vary and are based on patient characteristics like how susceptible the pathogen is to the medication. Susceptibility refers to how the antibiotic prevents bacterial growth. Jeff, can you talk to us about antibiotic resistance, another public health threat?
Yeah, so that's the big deal here. It's not just the cost and the hospitalization and the testing and the visits. There's a population health effort here, not just for STIs and transmission of it, but with UTIs and the number of antibiotics that are used to treat it can lead to antibiotic resistance. But overall, This is why we emphasize testing and curing the infection, because when used correctly and in the shortest duration, often as short as 3 or 5 days, antibiotics do work well for UTIs. But when people get those recurrent infections, and why we started with that, sometimes resistance to the antibiotics can develop. Resistance we see is when the antibiotic given is not sufficient to stop the growth and the infection will continue on or become more severe. One example of resistance actually comes from a study that reported that nearly 100% of urinary E. coli infections in some countries in the continent of Africa are resistant to amoxicillin because of overuse of that antibiotic. So increasing antibiotic resistance means the infections will be much harder to treat, they'll take longer to treat, and of course they're more costly.
Yeah, an important part of UTI treatment is preventing antibiotic resistance while simultaneously making sure that the infection is being treated successfully. So when looking at the population as a whole, we want to prevent antibiotic resistance. And in terms of patient effects and goals, we want to avoid recurrence and optimize antibiotic use and avoid antibiotics when they're not needed.
Yeah, that's why the emphasis is really prevention of UTIs or identifying them as quickly as possible. Of course, there are adverse events that may come along with antibiotic use, like vaginal yeast infections. A common thought is that antibiotics sometimes decrease the efficacy of hormonal contraceptives, but most studies show that most hormonal contraceptives are not affected at all, except when used with the antibiotic rifampin, which is infrequently used to treat, tuberculosis or Clostridium difficile or gut infections, things like that. But because of resistance, because of this widespread resistance, the number of infections and the quality of life that is affected so much by recurrent infections, researchers are looking into non-antibiotic options for treating UTIs. So let's dive into this, Liz. What are some of these things?
So cranberry is something we hear a lot about when it comes to UTIs. Its use dates back to the 1600s for treatment of multiple conditions, including liver issues and actually scurvy. It prevents the bacteria from sticking to the urinary tract, although the way that happens is not known at this point in time. Some formulations studied include cranberry juice, extract, tablets, or fresh whole cranberries. There were promising results when looking at prevention of recurrent UTIs. It wasn't as effective as antibiotics, and it wasn't really looked at as treatment, but pretty much everything said that more research is needed.
Yeah, actually, there's a group called the Cochrane Review, and in 2023, this group of well-established and well-regarded group of experts looked at all the data on cranberry, how rigorous the trials were, how many people they enrolled, was it prevention or treatment, did they use extract or tablets, whole bunch of things. And their conclusion is, it sort of was a meta-analysis of this, showed that it probably works to reduce the number of recurrent UTIs in people who are at risk of that. So what else do we have, Liz?
Another option being studied is D-mannose, which is a type of sugar that also blocks the adhesion of bacteria. Researchers published a vigorous study in April 2024 that looked at 2 grams of D-mannose powder taken once daily for 6 months and then compared it to a placebo powder. They found that compared to the group taking D-mannose to placebo, there were slightly fewer recurrent UTIs in the D-mannose group. Still, in both groups, over half the women had recurrent episodes.
Yeah, great study and kind of inspired this podcast as well. In that group, the scientists saw no difference between the groups in other outcomes, not just the primary outcome, include the number of days of at least moderate symptoms of UTI, so that goes back to that quality of life, the number of prescribed antibiotic courses for suspected UTI, so decreasing antibiotic use, which hopefully decreases antibiotic resistance, and then sort of the more severe things like hospitalizations or serious adverse events. We're 0 for 2. Anything else, Liz?
Yeah, NSAIDs or non-steroidal anti-inflammatory drugs like ibuprofen were also being studied as treatment instead of prevention like cranberry and D-mannose were. So a Swiss study compared an NSAID diclofenac to an antibiotic norfloxacin, both taken twice daily. The group taking diclofenac saw some symptom control, and the norfloxacin group had a larger percentage experiencing symptom relief. However, the group taking diclofenac experienced prolonged infections and had more complications. Ibuprofen is also being studied, but it was also associated with more hospitalizations.
Yeah, we started the idea for this podcast based on this promising study a few years ago that I enthusiastically taught to say, wow, we want to reduce antibiotic resistance. Let's use ibuprofen, get symptom relief, and maybe people get cure as opposed to antibiotics. But really, even though that trial showed no differences, we now have more studies. This is why we do science. And our hopes of greater antibiotic stewardship for UTIs have been dashed. We're 0 for 3, Liz. Can you tell us something positive?
Methenamine is an anti-infective that only works in the urinary tract. One of the reasons we get resistance from antibiotics is because the drug works not only in the urinary tract, but also in the gut where most of the bacteria that causes UTIs hang out. Methenamine increases the acidity of urine to stop bacterial growth without developing resistance.
Fun fact, Liz, the body, when it's exposed to methenamine in the urine, it turns it into formaldehyde, which is the preservative used in taxidermy. So pretty powerful stuff. And again, non-toxic to the tissues because it's only in the urinary tract.
So from what research has been done so far, methenamine can be beneficial in preventing recurrent UTIs, and it was pretty well tolerated, but again, more research is needed. And this one is in guidelines for recurrent infections.
All right, now we're getting somewhere. Anything else look positive?
Yes, hydration actually is being looked at as well. So this was more for the people who drank less than 1.5 liters of water each day. They saw a 50% decrease in recurrent UTIs when they drank an additional 1.5 liters each day. But this must be cautiously recommended for people with conditions like kidney or heart disease who may need to limit their fluid intake. And fluid intake was studied in mostly younger premenopausal women, so that's important to know.
Yeah, whenever we do treatment and whenever we teach folks in pharmacy school about how to choose your regimen, it's not just the drugs effects and the data behind it, but it's also who are you giving it to. So since postmenopausal women are at higher risk for and experience recurrent UTIs more frequently, do we have anything specifically recommended or that has been tested for this group?
Vaginal estrogen is being looked at for postmenopausal women. It comes in different forms like a cream, a vaginal tablet or capsule, and also a vaginal ring. So these products restore the acidic pH that's usually seen before menopause to prevent growth of pathogens and maintain the balance of good bacteria. The caveat with these products is that it takes months to see effects, and it comes with warnings to use caution in patients with estrogen receptor positive breast cancer.
Okay, so some good and some negative there, but that's why we work with our healthcare partner teams to give patients the best options. So now it's time for a speed round. I'm going to ask you some other non-antibiotic therapies that have been studied for UTIs, and you'll tell me whether they work or not. Starting now. Vitamin C.
Doesn't work.
Bearberry.
Does not work.
Acupuncture.
Jury's out.
What about there are these viruses that attack bacteria, and they're known as phage therapy?
So they only work when we know which bacteria is present.
Okay. Well, there's one, I like the name of this one, Aqua Libra, which is a combination of rest arrowroot, Java tea, and goldenrod herb. I bet it tastes delicious. Does that help?
We need Dr. Serum and Hume to work on these, but there's no consistent data nor recommendations to use this quite yet.
Oh boy. What about probiotics?
Maybe taken orally to prevent UTI recurrence. Vaginally applied probiotics are no better than placebo.
Yes, and yogurt doesn't work either. All right. What about bacterial vaccines?
Those are still being studied in humans, so stay tuned on that one. So basically, although most studies were relatively small, they showed some promising results, but ended with the need for further studies. And most studies involved women who had uncomplicated UTIs, so they weren't as severe as they could be. So at this point, antibiotics are still the gold standard of treatment. And for women with recurrent infections, they can take smaller doses of antibiotics either daily or after intercourse to effectively prevent UTIs. Hopefully, with further studies, we'll understand where these medications and supplements fit into therapy. If you are experiencing symptoms of a UTI, get tested. It's important to make sure you're treating the infection and not just masking symptoms.
So as we said earlier, as pharmacists and healthcare professionals, we have to think about what the patient wants and what works best for them in their situation. Just a caveat on the testing. I know we've been pushing that if you have symptoms, it's important to know what exactly is causing it so we can use the best treatment for it. We've talked about some prevention options, things that work and things that don't work. There is in the guidance, though, for uncomplicated UTIs, that if it's your first UTI and you're a young woman and you're not pregnant and you don't have any sort of anatomical reasons why you're more likely to get a UTI, you can actually safely get a short course of antibiotics without being tested as long as you have proper follow-up. So there is a significant group of people, again, first UTI, not pregnant, young women, premenopausal, no other problems, no other medications, not diagnosed with diabetes, that they don't need to get tested. But for everybody else, I think it's really important that you do get tested. So are there any studies, Liz, about what women think about some of these UTI treatments?
Yeah, there are studies about it, actually. An interview-based study that found that women, although generally believe treatment with antibiotics to be effective, are concerned with becoming immune to them. Many expressed that they were open to trying non-antibiotic treatments depending on other factors, like how intense their symptoms are. This opens a door for conversation about treatment options that will be effective, but still consider the patient's needs.
All right, Liz, take us out. What's the regimen for non-antibiotic treatment of UTIs?
In addition to antibiotic counseling, referral for testing for UTIs and STIs, it's really all about prevention. Pharmacists should give several effective recommendations to patients both before they get a UTI and to avoid the next one. This will be proper hygiene, fluid intake, avoiding spermicide-containing contraceptives, vaginal estrogen for postmenopausal patients, and likely cranberry products for all.
Dr. Steeman would be so proud. Check out that podcast and also Dr. Hume's, where we talk about other natural products and both used to make antibiotics and also maybe to help prevent UTIs. This concludes our episode on the non-antibiotic treatments for UTIs and prevention of UTIs. Be sure to follow at PharmD.PubHealth. That's at Pharm as in pharmacist, PharmD as in doctor, Pub Health on Instagram, and connect with us on LinkedIn. Turn on post notifications so you never miss an episode, and smash that subscribe button now on Spotify, Apple Podcasts, YouTube, or wherever you listen to podcasts.